Hi everyone. Today I am going to discuss what are the questions will come in post BSc Nursing Foundation. So most of the post BSc students are worried and they will get so much anxiety, like what kind of question they will get, whether they will pass or not, how many 10-mark questions will come, 5-mark questions, what are the 2-mark questions will come, and they will be in a so much hurry to read all the book, to read the entire book, and in a short time to complete the entire book it's not possible. So if anyone have not studied before that, yeah, if anyone have studied already on that also, when the exam is nearer, they need to practice a lot and they should know what are the probable questions are there that will come in your exam. If you study on that questions particularly, you can able to pass or you can able to get a good score. So you should know, like if you study the entire book and if you remember few things, means it will not be both. So you need to know what are the possibility, I mean what are the most important questions are there. If you work on that, then only you can able to get a good mark or good score. So you should know according to the each unit, you should know what are the 10-mark questions, what are the 5-mark questions, and what are the 2-mark questions. Apart from that, many members, many of them, they will prefer to see the previous year question paper. Yeah, sometimes to see the previous year question paper is worth. Okay, and apart from that also, it's not guarantee that continuously previous year question paper will come. Sometimes in our college, yeah, in your college, yeah, in your teachers and all, they will suggest you to read the previous year question paper. But are you thinking that to read previous year question paper is worth for you? I mean, on depending on that, you can able to get a good score on that? No, you need to study, you need to focus on that particular questions, or you need to focus on that particular point. If you write on that point on your paper, then you can able to get a good score, right? So I will discuss according to the syllabus individual unit, what are the possible 10-mark questions are there, what are the possible 5-mark questions and 2-mark questions, and according to that you should work on that questions. Next one, you should know what is nursing foundation. Nursing foundation is a foundation of a nurse. I mean, this is the first year subject. So until and unless you will not know about what is nursing foundation, you can't go to the other subject, right? So आज student nurse, so as a nurse you should know what is nursing foundation. On that nursing foundation, what are the things are there? Okay, like at example, if you will become a nurse, so what are the things you should know? First, you should know what is the definition of nurse, right? Then what is the definition of health, what is the definition of illness. So definition of health will be there according to the different different author. Okay, according to the Florence Nightingale, what is the definition of health? According to the WHO, what is the definition of health? What is illness? What is the definition of illness? What is the effect of health and what is the effect of illness on a person's? Okay, then apart from that, different kinds of models are there, that is also you should know, especially Maslow hierarchy of model. That is very important question which will be there in nursing foundation. In a psychology also this model is there, so you supposed not to skip this model. Okay, apart from that, like vital signs and all, that is also very important. Temperature, pulse, respiration and all, that is also you should know. What is nursing as a profession? As a student nurse, you should know what do you mean by nursing as a profession. So nursing as a profession is very important. You should by heart the definition of nursing as a profession. Apart from that, what are the other? Biomedical waste management. Biomedical waste management, like after completion in your post BSc, maybe you will work in a hospital. So while you will work in a hospital, you should know what is biomedical waste management. On that scenario, you should you should thorough about the biomedical waste management. What are the possible codings are there? What is biomedical waste management? Okay. Apart from that, different kinds of theory, different kind of models are there that you should remember. You supposed not to skip related to that. Okay. So that is the meaning of nursing foundation. Foundation means what? The meaning of foundation means base. So as a nurse, you should know what are the bases are that. So that's why nursing foundation you should know as a first year post BSc students. So I'm moving to the nursing foundation syllabus. Okay. According to the syllabus, each unit, what are the possible 10 mark questions, 5 mark questions and 2 mark questions will come. Okay. So first I should discuss unit number 1. So unit number 1, first number 1, 10 mark questions maybe you will have a chance to get development of nursing as a profession. So 10 mark questions on that, maybe 5 mark questions will come, yeah 10 mark questions will come. Okay. So in a 10 mark questions maybe they will ask you define nursing profession. Okay. Like what are the under that you need to explain, you need to elaborate the nursing as a profession. Okay. And what are the qualities of a nurse and its philosophy, that is compulsory, you supposed not to miss these questions. This is a 10 mark questions. Okay. Then after apart from that maybe you will get a 5 mark questions and 10 mark questions also. Remember, 10 mark questions you need to elaborate each and every point under that. 5 mark questions little elaborate you should do, but you supposed not to miss the main point. Understood? You should understand the difference between 10 mark questions and 5 mark questions. 10 mark questions, each point you have to write and you have to elaborate each point. In 5 mark questions, no need to do that much elaboration, but point you supposed not to skip. So on that, objectives and responsibility of a graduate nurse, like what is the goal of a nurse, what is the functions of a nurse, what is the role of a nurse, what is the responsibility of a nurse, you should write. Okay. So compulsory you will get 5 mark questions, either role of a nurse, functions of a nurse and all. Okay. Understood everyone? Okay. Then come to the next one. 10 mark questions. What are the trends which influencing the nursing practice? Mostly these questions will come like 50% chances are there, but you suppose not to miss this one. Trends influencing the nursing practice, either you will get 10 mark questions. Okay. The next one will moving to the next questions. Next question on unit 1. Everyone should note it down what are the possibility questions are there which will come in your exam. Okay. The next one is 5 mark questions. Maybe you will get expanded the role of a nurse. So role of a nurse, what is the definition of nurse, what is the role of a nurse? Remember this one. If the questions will come in a role of nurse, directly don't go to the point that role of a nurse. Directly don't write. If you want to impress the examiner, if you want to get a good score, first you should write the definition of a nurse. According to the like 2-3 definition you need to write, then you should go to the next one, role of a nurse. Okay. On the role of a nurse as a caregiver, researcher, what are the points are there? I think you people have already studied in your first year. You are going to write the exam, so I think for according to my side no need for that much explanation, you should know very well. As a nurse you should know the role of a nurse. So as a role of nurse, each point you need to explain. Okay. So mostly role of a nurse, maybe you will get a 5 mark question related to the role of a nurse. Okay. Then apart from that, the next question in the unit 1, development of nursing education in India and trends in nursing education. Maybe you will get related to that some 2 mark questions, yeah, some 5 mark questions. A possibility will be there 40%. Apart from that, what are the other questions I have discussed, that you can focus on that. Okay. Then next one. Then professional, what is nursing as a profession, professional organization and what are the care planning. Apart from that is very important, you supposed not to miss code of ethics. Code of ethics is very important as a nurse. Although now you all are student or after pursuing your nursing, when you will work in a hospital, you should know code of ethics. Many of them, they don't have an idea what are the code of ethics they will write. Okay, so under the code of ethics, every time, and this is a favorite questions of university, Rajiv Gandhi University, this is a favorite question. Every time they will put the code of ethics. Okay, so under the code of ethics, each and every point you need to explain, and what are the professional conduct for a nurses. Okay, so code of ethics and profession you should explain elaborately. Understood unit number 1? So unit 1 is very very important. Okay, so unit 1 you should not forget to study. Okay, then apart from that, what are the ethical and other issues are there. Okay, so that you should study. Okay, next one we'll move to the unit number 2. Unit number 2, what are the unit number 2? It is that ethical, legal and other issues in nursing. Okay, so what is before that already I have explained you what are the code of ethics, what are the legal issue related to the nursing, what are the ethical issue related to the nursing. Okay, so maybe you will have a chance to get a 5-mark questions. Okay, next one, concept of health. Concept of, like how I told you, that is very very important, like nursing as a profession, that is very important questions, and this is a favorite questions of university, as well as this question is repeatedly coming from from a very long time. So like this is also the favorite question. You supposed, as a nurse, you supposed not to miss these questions. Concept of health. Okay, so concept of health, illness and effect on the person. So on the concept of health, you need to write the definition of the health, and what are the concept, what are the models are there, and what is the concept of illness and definition of the illness, and what is the effect of the health and illness on a person. Then this is very very important, 10 more questions on the concept of health or on the concept of illness. Individual models are like 5 to 6 models are that. From that model, maybe they will put a questions like elaborate this model, elaborate that model, so that you need to explain each model. Like how I told you, apart from from that model, Maslow hierarchy of needs, one of the model. Okay, you should put a nice diagram on that, and you should elaborate that model. That is very very important. Okay, next one, maybe you will have a chance to get a 5-mark questions. What is stress and adaptation? Like what is the definition of the stress? Okay, what are the type of stress and what is the adaptation? So that you need to write. Next one, healthcare concept and nursing care concept. What is the concept of the healthcare and what is the nursing of healthcare? That is not that much important, but you should go through that, and you should study, at least you can able to write something. Okay, next one, development concept, needs and roles and problems of the developmental stages of the individual. So according to the individual, maybe there are different stages are newborn, infant, toddler, pre-adolescent, adolescent, middle age, old age. So what are the developmental stages are there? So according to each newborn you need to explain the developmental stages. Infant you need to explain the developmental stages. Toddler you need to explain. Pre-adolescent, adolescent and middle age and old age. So that you will have a questions, 5-mark question related to this one. So what you understood from the unit number 2, health, definition of the health, definition of the illness, healthcare concept, that model you should by heart, or if you can't able to by heart also, you need to understand what you need to write. Okay, and developmental stages of different age group. Newborn, that you need to elaborate. Infant, that you need to elaborate. Toddler, pre-adolescent, adulthood and middle age and old age. So that you need to write in a unit number 2. So unit number 1, important question, nursing as a profession, role of a nurse, then functions of a nurse, trains in nursing profession. Unit number 2, what is the important question? Healthcare concept, illness, different kind of model you need to explain, especially Maslow hierarchy of needs, and different kind of developmental stages in newborn, infant, toddler, pre-adolescent, adulthood and middle age and old age. That you need to write. So mostly from this unit maybe you will get 10 mark questions and 5 mark questions. Okay. Next one we'll move to the unit number 3rd. Unit number 3rd, it will come theory as a nursing. So different kind of theories are there. Maybe you will get a 10 mark questions, theories in nursing. So what are the theories are there? From that theory you should go and you should study. Remember this one, while you people are writing in a exam paper, don't write in a paragraph wise. Whatever the points you are writing, write in a, give a particular point or give a particular mark and write it properly. And you should not cut that point, you should not confuse that point. So while you are writing, you should write. So that only you can able to get a good mark. Apart from that, many of the people will write something in a definition, they will write something inside that, they will write some different kind of content. So if the examiner will see, maybe they will, most of the students they will tell that ma'am, we have written everything but we didn't get the mark. Actually you people should know how to write properly in the exam. It's not like that you will study the entire book and you will write everything and you will get a distinction or you will get a good mark. It's not like that. You should remember or you should know how to write in a proper way. So that you should know. Suppose healthcare concept will come. So you should write directly, don't go to the point. You should write some definition of the health. What is a health? What is a illness? Like that you should write, and each and everything you should put a particular point. Apart from that, different kinds of models are there. In the model, like before elaboration of the model, you should write, first you need to do the particular diagram. On that diagram, what are the concept of that you need to write. Okay. So that is a unit number 3. Unit number 3 is theories of nursing. So maybe you will get a 5 mark questions about that. Okay. Then next one we'll move to the unit number 4, nursing process. Nursing process is very important. As a nurse, you should know, like how I told you, nursing as a profession is very important. Nursing process, which will be useful in your entire nursing, like up to your 4th year, when you will go to the different kind of subject. Okay, nursing process, this is the foundation of nursing process. You should supposed to know whether you will work in a medical surgical ward, whether you will work in a gynae ward, whether you will work in a psychiatric ward, whether you will work in a community. So as a nurse, you should know what is nursing process. Suppose when you will work in a hospital, like you don't know how to assess the patient, how to write the care plan, like what are the possibility diagnoses are there, how to write the diagnosis. This everything you will get to know in a nursing process. So this one you supposed not to skip this unit. Definitely you should study this nursing process. Okay. So nursing process, first you should know what are the assessment, what is the assessment of nursing, how to do the assessment, type of assessment, what are the tools we are using for the assessment. Okay, the like inspection, palpation, percussion, auscultation, then physical examination, type of physical examination, what is recording, how to plan, how to do the proper care plan, how to write the care plan, what are the technique are there, what are the care plans are there. Suppose you have fever patient, so fever patient, what kind of care plan you should write, vomiting patient, what kind of care plan you should write. So mostly you all are first years, maybe you already know when you are posted in a hospital, maybe they will give you some kind of like fever patient, diarrhea patient, vomiting patient, dengue patient. So you should know what are the care plan you need to write. Okay, so this unit is very important. Nursing process, maybe 10 mark questions you will get. Write the define assessment and type of assessment. On that assessment, physical examination, in that care plans also you will also have a chance to get either vomiting, either diarrhea, either some other condition. Don't worry, you will not get any critical condition. Okay, then what are the tools, what are the nursing tools are there, how to evaluate whether whatever the care plan we are writing or whatever the care we are giving to the patient, what are the evaluations, what kind of tools we are using for the evaluation. So that you need to write. Nursing process is very important. Okay, so this is the 4th unit. 4th unit is supposed not to skip this 4th unit. Okay, so as a nurse you should study at least assessment, physical examination, type of assessment, type of physical examination, or with that you will get a one care plan. They will put one particular condition, they will tell to write that particular condition care plan, that you need to write. Minimum 5 care plan, 5 diagnosis you should write, and 3 care plan you should elaborate. And one more thing, when you are writing the care plan, so what you people are doing, assess the patient's condition, check the vital signs and all. So this is some common points what most of the members will write, and they will the same care plan, like if they will write the 5 diagnoses, they will write the same points on that. Apart from that, you should know like to write some point in a different way, so that we can able to catch the examiner point. So while you are writing the care plan, you should be very careful what care plan you will write. Like I have seen many of my students, they have written like assess the patient condition, check the vital signs, and most of the favorite points of student, give psychological support to the patient. So psychological support will come in a last point. First you should know, suppose if it is a fever patient, so what are the things you should write? Assess the patient's condition, or patient's like everything you should write in a past participle form. Like then check the vital signs of the patient, especially temperature. If you are noting the temperature is high, that is also you should write any intervention that patient temperature is high. Okay, apart from that, either you are giving sponge bath or medication, that everything you should write. So that is a one example of care plan of fever. Okay, so related to that, if it is a fluid electrolyte imbalance, diarrhea, vomiting, you should know, you supposed not to write that check the vital signs in case of vomiting care plan, diarrhea care plan. So you should know the condition of the patient. Depending on that, you should know what are the points you should write, then only you will have a chance to get a good marks. Okay, the next one will move to the unit number 5. Unit number 5, quality assurance. What is quality assurance, and what are the nursing standards are there, protocols are there. Maybe you will have a chance to get a 5 more questions. Okay, and this very important questions. Don't skip to study nursing audit. Nursing audit is very important. You will have also exposure in nursing management also. So what is the nursing audit, type of nursing audit, that you should not forget to write, that you should study. Nursing audit is very important question. Before that I am telling you, maybe you will have a chance to get a 10 mark questions, 5 mark questions, or you will also have a chance to get a 2 mark question. Write define nursing audit, to write the definition of the nursing audit. Okay, next one, role of council and professional bodies in maintenance of the standard. So what are the professional bodies are there, either local, either national wise, that you need to write to maintain the nursing standard. What is the role of different council, that maybe you will also have a chance to get a 5 mark questions. Okay, next one will move to the unit number 6. So on a unit number 6, so you need to write what is the important questions, primary healthcare concept. So you need to understand what is the definition of the health, and what are the different kinds of concept are there, healthcare concept. Okay, then community oriented nursing. So what is the definition as a role of a nurse, what is the role of a community health nurse, community oriented nursing. Then you should write the definition of the what is the meaning of holistic nurse. Maybe you will also have a chance to get 2 mark questions. Define holistic nursing, define the role of a holistic nurse. So that you should study community health nurse, role of a community health nurse, role of a holistic nursing. Then define primary nursing, what is the role of a primary nurse, so that you should write. Then family oriented and nursing concept, progressive patient care. So what is the family oriented concept are that is not that much important, but you should go to that. Maybe if any questions will come related to that, you can able to write. Okay, then what are the problems are there oriented to the nursing team. Nursing team means what are the problems will come, what is the definition of the nursing team, who else will come under the nursing team, and what are the problems will come, you should write. Then we'll go to the unit number 7. Unit number 7 is very important, like how I told you. Unit number 1, Unit number 4, unit number 4, unit number 1, 2, 4, okay. Then unit number 7 is also very important, biomedical waste management. Like before that in class, before that already I told you biomedical waste management is very important, and this is also the favorite questions of university. So biomedical waste management, you should know according to the WHO what is the biomedical waste management. First you should write the definition. What do you mean by biomedical waste management? After that, what are the things you need to write? Compulsory will get a 10-mark question. 100% guarantee you will have a chance to get a 10-mark questions. What are the type of waste? Okay, so what are the types of waste are there? What are the method of disposals are there? Like either it is a sharp waste, in which color code, in which dustbin we should discard, whether it is a solid waste or either any medicine waste, cytotoxic drug. What are the methods of, like in which color code, in which dustbin you should discard, and what are the methods of disposal are there? Either incineration, deburial, so landfill, so different kind of methods of disposals are there. You should write. So understood everyone? So the last unit is biomedical waste management. On the biomedical waste management, you should write the definition of the biomedical waste. Okay, according to the WHO or ICD, what is the definition of the biomedical waste management? Then type of biomedical waste, then what are the category of the biomedical waste are there, and what are the codings are there. Like what are the codings? Maybe you have seen in a hospital, like green color, black color, or blue color, then yellow color, red color. Okay, green color for general waste, black color for paper waste, then red color for infected plastic waste, or blue color like sharp waste, cytotoxic drug, anything, any body related waste, so that you should discard in yellow color, that you supposed not to miss. So I hope everyone know properly this biomedical waste management. If people will not study also, you can able to write it properly. Then method of disposal, according to the each waste, a different kind of category of waste you should write, and you should write what are the method of disposal, what are the type of methods are there, which kind of waste in which method we should disposal. Then you need to write, you need to elaborate briefly. Okay, so mostly biomedical waste management is a big topic, so mostly 10-mark questions means each and every point you need to touch, and a very important point only you should write. It's not like that the entire book if you write also, you will also not have a chance to get a good mark. So you should know what are the important points you will write, so that only you can able to catch the eye of an examiner, like who is to see your paper. So like what are the methods of waste, disposal of waste, then role of a nurse in a biomedical waste management. Okay, so I hope everyone understood what are the possible 10-mark questions, 5-mark questions are there, or 2-mark questions are there, which will come from the nursing foundation. Okay, so again I am telling, mostly 2-mark questions will come, mostly you will get a definition or related to some theory. Maybe they will ask you elaborate this theory, elaborate nursing as a profession, definition of the health, definition of the illness, explain this model. Only 2-mark questions, biomedical waste management. Okay, so 2-mark questions is like a definition you will easily get in your book. If you study according to the each unit, if you go to the book and if you read, some important 2-mark questions are there, you can go through that. Apart from that, again I am telling you, if you are having very less time, and if you want to study the entire nursing foundation, so you should know what are the possible questions are there, so you should work on that, then only you can able to pass. And apart from that, before that already I am telling you, you can go to the previous year question paper, you studied the previous year question paper. Apart from that, what are the possible important questions are there, so that you should go on that. Like already I told you, unit number 1 is very important, you supposed not to skip. Unit number 2 also very important. Unit 3 also you can study, but mostly 5-mark or 4-mark questions will come. Unit 4 is very important, nursing process, and like theories of nursing also you can go to that. Maybe you will also have a chance to get a 10-mark questions. And the last one is biomedical waste management. I hope everyone understood my class, and what are the important points or 10-mark questions I have already discussed. You should work on that, so that you will also have a chance to get a good marks in nursing foundation. You're supposed to miss to study, you're supposed not to miss the study of nursing foundation, because this is the base of a nurse. So I'm going to discuss few questions which came in June 2024 for the post BSc. So already I told you, like mostly total mark will be 35 mark, and you will have only 2 hours to write all the questions. Okay, so first maybe 10 mark questions you will get. So 10 mark question, 10 mark questions will come in your options will come, like 2 mark or like 2 10 mark questions will come, you need to write one. So like one of the questions came in June, explain the steps in nursing process, explain in detail the assessment. So while I have taken the class, already I told you, like nursing process is very important, you should write the steps in the nursing process, and what are the methods of assessments are there, and what is the assessment, what are the methods of assessment, that you need to write. Already I told you 10 mark questions you will get. So these questions also already came in June. Although these questions came, many of the members will think that already these questions came in this year 2024 June, why should you study? But you supposed not to do like that, you should cover these questions also. Okay, so next question maybe you will get a 2 10 mark questions you will get, from that you have to write one. So 1 10 mark questions you have to write. Okay, so process of nursing process, so that you will get so what are the nursing processes are there, so that you will get a 10 mark question. Okay, so that 2 10 mark questions in options it will come, you need to write it one. Okay, so the next one maybe you already have gone through that recent question, because those are preparing for the exam already have gone through that questions, that again I am doing the revision so that you will not forget to study. Okay, then apart from the long question, you will also have a chance to get a short essay. So short essay, maybe 5 short essay you will get. From the 5 short essay, you need to write any 3. So 5 into 3 is equal to 15. So what are the short essay you will have a chance to get? Explain the development of nursing education in India and trends in nursing education. So while I have discussed previously what are the trends are there, so maybe they will put a short essay questions 5 mark, explain the trends in nursing education. That maybe you will have a chance to get a questions. Not only this time, you will also have a chance to get a question in upcoming exam also. Next questions came, discuss progressive patient care. Okay, so discuss how to do the patient care, that maybe you will have a chance to get a 5 mark. Okay, then role of council and professional bodies in maintenance of the standards. So while I have discussed that this is also very important, role of council and profession, what are the type of councils, what are the professional bodies are there, how they are maintaining the nursing standard, maybe you will have a chance to get a 5 mark questions. Okay, then so that is the 15 mark. Then 2 mark 5 questions you will get, that is 10 mark. So 10 mark questions, like how I told you biomedical waste management will come, like they will ask you what is a cytotoxic drug, explain the cytotoxic drug, only you need to write the definition of the cytotoxic drug. What is team in nursing, definition, write the definition of the nursing team, like what are the who else will come in a nursing team, or maybe the questions will come, write the different kind of waste, solid waste, what is the definition of the solid waste, and what is the method of disposal, in which container, in which color code container we need to discard the waste. Then define meta-paradigm. Meta-paradigm maybe 2 mark questions will come, that you need to write the meta-paradigm. And the last question is ethical issue in nursing practice. Maybe ethical issue in nursing practice, if that thing will come, don't write only the definition. If you will write the definition, out of 2 mark, maybe you will get a half mark, 1 mark questions. Not only ethical issue, with ethical issue, under the ethical issue, what are the points are there, only you put it, only you write the points. So you remember, write the definition of the ethical issue, and under the ethical issue what are the points are there, what are the ethical issues are there. No need to do the elaboration, only you should write the points, number 1, number 2, number 3, number 4, like that you should write the ethical issue. Then only you will have a chance to get a 1.1.5 mark out of 2. Yeah, 2 out of 2 he will have a chance to get. So this is a very common question which I have discussed, like very important question in nursing foundation, which came in this month, this year June. Okay, so apart from this question, you should focus on the other question which I have discussed previously. So you should focus on that and you should work on the particular questions. If you want more questions, and already the questions and practice questions are also there in the Nursing Guru application, already the link is there in the below, so you can click on the link. By clicking the link directly you can able to practice the question. So whatever the subject, whatever the things you have studied up to 1 year, you have studied previously, now it's a time to practice the question. So lot of members, I have seen lot of members, although they will not study properly, but they used to do the practice question properly, like before 1 month. If we'll focus on the questions, if I have not studied properly also, if we'll focus on the question also, you will also have a chance to get a pass mark. So you should work on that. So whatever the topics, whatever the important topics I have discussed in nursing foundation, you should stick to that topic. I hope everyone understood what the questions are there, what are the possible questions will come. You should stick to the point, and I hope that everyone will get a good marks in nursing foundation. No one should get a paper back in nursing foundation. Thank you.